My name is Madden, Gadigal Elder. Does anyone here own a white Toyota? Because it's getting towed away now across the road. Just in case you want to run across it. Anyway. As I mentioned, my name's Alan Madden, Gadigal Elder. For my first song, And as I've mentioned many times before, born and bred in Redfern, the capital of Sydney. Married man. 10 children. 26 grandchildren. And in addition, 18 great-great, as of yesterday. Yes, we did have TV. Just couldn't afford the bloody electricity. Welcome to country to me is always an honour and a pleasure. Just to give you a little bit of an insight of where you are and who we are. As with all welcomes, firstly, I'd like to acknowledge our First Nations and traditional owners of the lands that you may have come from or work upon, and pay my respects. To all our Aboriginal elders, all elders, past and present, also pay my respects. To all our Aboriginal and Torres Strait Islander brothers and sisters, from whatever Aboriginal or Island nation you may have come from, welcome to Gadigal. And to all our non-Indigenous brothers and sisters here today, a very warm and sincere welcome to you to Gadigal. No matter where you've come from, whether it be across the seas, across the state or across town, once again, a very warm and sincere welcome to you to Gadigal. And as I've mentioned many times before, was, is, and always will be Aboriginal land. Only three things short than that: coming, taxation and going. It's an honour and pleasure to be here today to welcome one and all to Gadigal. Gadigal is one of 29 clans of the Eora Nation. The Eora Nation is bounded by nature's own, the Hawkesbury River to the north, Nepean to the west, and Georges River to the south. And in between those three mighty rivers is the Eora Nation. And in that nation, there are 29 clans. And the clan's land we're on today is Gadigal. On behalf of members of the Metropolitan Local Aboriginal Land Council and of the Gadigal mob, once again, a very warm and sincere welcome to you to Gadigal. There's an old Aboriginal saying out there, I think it's very appropriate for you mob here today. They say, where there's a will, there's relatives. And as you travel across these traditional lands and waters, may the spirits of our ancestors guide, look over you, and keep you safe. So once again, on behalf of the Land Council and of the Gadigal mob, welcome, welcome, welcome. Thank you.
All right. Good morning, everyone, and a big warm welcome from me to the New South Wales Primary Care Cancer Control Symposium, which is proudly sponsored by the Cancer Institute of New South Wales. Uncle Alan, I'd like to thank you for that heartfelt welcome to country. I'm always moved by Uncle Alan's words, your passion and your generosity in your welcome. I too would like to acknowledge the traditional custodians on the lands on which we're all meeting today, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. And importantly, I acknowledge that the sovereignty of these lands was never ceded, and this land was and always will be Aboriginal land. I also extend that respect to many Aboriginal colleagues in the room today. And I'd also like to take a moment to acknowledge the disproportionate impact of cancer on our First Nations people, particularly lung cancer, which is the focus of today's discussion, and reaffirm the Cancer Institute's commitment to listening to, being led by and partnering by Aboriginal health agencies, people and community to reduce the impact of cancer on current and future generations of Aboriginal people. The Cancer Institute also acknowledges and recognises the importance and wisdom of people with lived experience of cancer. The consumer voice is incredibly powerful, and the contribution that it makes in shaping continued improvement and focus on really what matters most to people, all people across all communities in New South Wales is highly, highly valued. For those of you who I haven't had the pleasure of meeting, my name is Professor Tracey O'Brien, and I am privileged to serve as the New South Wales Chief Cancer Officer and the CEO of the Cancer Institute. I have the great pleasure today of co-hosting and emceeing this event together with my colleague, Professor Charlotte Hespy AM. Charlotte's the chair of the Cancer Institute New South Wales Primary Care Advisory Group, and will be giving the address shortly after me, so I'll say more about her in a moment. Before we dive in to today's program, I'd like to acknowledge and thank you all for coming today. What started as quite a small workshop has ballooned into a much larger event with huge interest, with commitment, and with representation right across the health and community sectors from all corners of New South Wales. It is really terrific to come together to have what I hope is a great opportunity to help shape the New South Wales implementation of the National Lung Cancer Screening Program. Now, the collective intelligence in this room is staggering. It's worth millions and millions of dollars worth of free consultancy. So I encourage everybody to ask lots of questions, to contribute to the panel, and to really share your unique perspectives. I'd like to acknowledge the attendance. I haven't seen Christine Giles walk in yet, board chair of the Cancer Institute, but I believe she is coming, and board members, the Honourable Gillian Skinner, our former Health Minister, and Lillian Lee, who have joined for the day. This is a national screening program, and it's the Commonwealth Department of Health and Ageing who are leading the implementation of this program, and we have representation in the room from the Commonwealth, as well as their implementation partners, Cancer Australia and the NACCHO, National Aboriginal Community Controlled Organisation as well. We've also got representation from the Aboriginal Health and Medical Research Council of New South Wales and from several of the New South Wales community-controlled health organisations. We've got representation from Justice Health, colleagues from Drug and Alcohol and mental health branches, from Lung Foundation Australia, from ACON, representing the LGBTQ+ communities, from Cancer Voices, from Health Consumers New South Wales, from homelessness, from many multicultural health stakeholders, from Rural Doctors Association, from the New South Wales and ACT Primary Healthcare Networks, of course the RACGP, we're from Telstra Health, from New South Wales branch of Cancer Council. Now, importantly, in addition to Charlotte as the chair, there are also representatives here in the room from the Cancer Institute's Primary Care Advisory Panel. And a special shout out to Professor Rowena Ivers and Dr. Lee Fong, and the unstoppable consumer on that advisory is Tit Thew. We've got many primary care providers, physicians in the room, as you'd expect. 9 of the primary health care network leads right across the state have signed up for the event today. We've got nursing, allied health specialists, oncologists, respiratory physicians, surgeons, integrated care and cancer service managers, and other clinical staff across most metro, regional and rural LHDs. And there's a few academics in the room. So this really is the hottest ticket in town. And I hope I haven't, did I miss anyone in that? No. That's good, because there was a chocolate frog, which I'm desperate to have for breakfast, for anyone that I did miss. So, look, your insights and your expertise and your unique perspectives really are vital into today's conversations. And I thank you for taking the time out of your incredibly busy schedules to attend. We've got some incredible speakers and panellists today, and I thank them in advance, and we'll introduce them as we go. It really is an exciting time, the opportunity to deliver a program that has the potential, if executed well, to save thousands of lives every year. This will be the first new cancer screening program in Australia in 20 years, and it's the first risk-based program. It's a program that is tackling head-on Australia's deadliest cancer. It's also the first screening program addressing social determinants of health, with the potential to improve more equitable access and outcomes to the communities most in need. I mean, no wonder there are so many keen to learn more about the implementation of the national screening program, to be engaged and to be a part of the implementation process so that they can best serve the community that they represent. But of course, implementation is not without significant challenges and barriers, and I think we need to be real in our conversation about that. And given the program really targets the more vulnerable, it's really beholden on us to get this right. The Commonwealth has a tough remit to succeed, and the go-live date is July 2025, so it's just around the corner. As I said, the Commonwealth has engaged Cancer Australia and NACCHO as their primary implementation partners, which importantly means that the program of work will be designed with and for Aboriginal people. And we really look forward in New South Wales to supporting that. There are other key NGOs also taking lead role, such as Lung Foundation Australia, and we'll hear from Mark later on this morning, who are leading the consumer engagement in priority population, really to ensure that the voices are heard and can be informed in this program design and program implementation. Cancer Institute of New South Wales is really acting as a catalyst today. We're excited to be able to leverage our vast networks and our relationships and with stakeholders and partners right across New South Wales, so that we can ensure that as a system we can be as well prepared for the program as possible. As I like to do when we have sessions like this, I took a quick temperature check of views around the room as people were having coffee this morning, and three things were repeatedly kind of said. There's still a lot of detail to understand and unpack, and that old cliche of the devil is in the detail was repeated. We know that there are many aspects of the implementation design that are still being worked through at a federal level, such as how a mobile service might be provided and the functionality of some of the National Cancer Register. But the key to success really will be that collaboration between the national approach and the jurisdictional implementation. New South Wales providers and consumers really do want to ensure that we're well connected to the Commonwealth plans and decisions, so as to maximise the opportunity and success for New South Wales people. We're really happy to test ideas, to test assumptions, and to help inform the implementation. So I encourage the implementation partners really to make use of the great wisdom and knowledge of working on the ground in this room. One could make the argument that as the state that is proudly home to the greatest number of First Nations people, the greatest number of multicultural communities, the greatest number of people living in regional, rural and remote communities, if you get it right in New South Wales, you'll get it right for the country. Now, the other pulse check in the room read over the welcome coffee chats was that there's a bit of concern that with many key agencies at a national level leading the work, there's a risk of confusion and perhaps overlap, maybe some gaps. And I heard of people talking about really learning from past mistakes and we're not repeating the mistakes of the past. So I put that out for something to think about today. And then the last key tidbit I got from my buzz around the room with morning coffee is that although people appreciate this is a Commonwealth-led program, the works of the states, of the territories at the coalface across primary care, across and how that integrates in with investigation and treatment at the tertiary level really is incredibly important. It's really where the rubber hits the road, and the true benefit of the success of a program will be realised. I also wanted to acknowledge that there are concerns, and I'm sure we'll hear more about this today, and certainly the Commonwealth are aware of this, jurisdictions have passed this back, that relate around the funding models and those largely being focused just on the low-dose CT scan. And there's real genuine concern about the impact on primary care, ability to be able to deliver services, the expectation to be able to deliver service, and I'll allow Charlotte to speak about that, but also on hospital services as well, to investigate people in a timely manner when there's a lot of additional work, systems are under strain, and there are workforce constraints as well. Past experience of the bowel screening program, we really did learn how important it is to be prepared and to have the logistics and the operational detail organised before referrals started to flow in. Otherwise, both patients and healthcare providers, their experience of a screening program, initially, if it's poor, can really have quite a negative ripple effect that can impact on future engagement. So the Cancer Institute really is eager to ensure the program does roll out successfully, and I'm sure everybody in this room shares that eagerness. And we've established 4 work streams to help try and work in a well-coordinated way and happy to add value in any way we can, and they include primary care and screening pathways as the obvious focus, but also diagnostic and treatment pathways, how we can have a role in communicating and data and research and sharing assets and intelligence that we have. The key to success really will be listening to, leveraging the local expertise, the experience and the insights. So today's the opportunity to have a great conversation, a robust, respectful conversation, and really work collaboratively to understand what challenges there may be, but really to talk about solutions as well, and to share those solutions or opportunities for success. Before I hand over to Charlotte to sort of kick things off and officially get underway, just a couple of housekeeping announcements. We will have questions after each of the speakers. We have got Slido. Everybody likes Slido apart from me. So there's the thingy there. You can jump online. You can ask your questions. You can ask them anonymously. You can put your name to it. But we will, because I'm old-fashioned, we will have microphones, and I love to run around the room and pretend I'm Ellen DeGeneres and stand there. So if you want to just do it old school and put your hand up, the room is small enough, and I think it helps to encourage a conversation as well. We're not having a workshop like we've had in previous years. really because we wanted to prioritise time for a bit more question and answers and panel discussions and networking in some of the breaks. But there is an opportunity to share your ideas, to be heard if you haven't had the opportunity. There are flip charts, you can see them around the room at the back there, for you to write down any comments you've got, any ideas you've got that might be useful for implementation partners. And I believe we are recording today's session as well because it was oversubscribed. So we will put a link to people who would like to be able to view that, and you're welcome to share that with your networks as well. All right, Wi-Fi is available. If you haven't figured it out already, the network is Ridge's event. Password is conference with a lower C. And there will be opportunity for networking at the breaks, but also after the event today. If you've got time, please stay for some refreshments at the end of the official program, and we'll continue to have conversations and an opportunity to connect. And lastly, just to remind you to put your mobiles on silent or vibrate.